This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to the Manager of Corporate Communications, the Ministry of Health, Ms. Candice Alcantara.
Pleasant good morning and welcome to the Ministry of Health's virtual media conference, which will provide an update on the Ministry's COVID-19 response. With us today are Dr. Roshan Parasram, Chief Medical Officer, who will provide the clinical update, and Dr. Naresh Nandram, Principal Medical Officer, Epidemiology, who will explain the epidemiological phases of log and lag. I am Candice Alcantara, Manager Corporate Communication at the Ministry of Health, and I will moderate this morning's media conference. We move straight into the clinical update from Dr. Parasram.
Good morning. Thank you, Ms. Alcantara, Dr. Nandram, members of the media, members of the viewing and listening public. So my clinical update for Monday, 17th of August 2020 is as follows. The total number of tests done, 14,651. Total number of unique patient tests thus far, 12,438. Total number of repeated tests, 2,217. Total number of private sector tests with the week ending 7th of August 2020, 2,458. This brings our tally to 17,109. Total number of active cases now are at 413. The total number of positive cases, including the phase 1, is 565. The number of deaths now stand at 12. Number of persons discharged at 140. We would have had since 4 p.m. to present yesterday 13 cases, 9 in Trinidad, 4 in Tobago being new cases. In terms of the hospitalized patients, at the Cora Hospital, we have 49 individuals at present. At the Cuva Hospital and Multi-Training Facility, there are 100 persons. 3 of those are in high dependency unit, none at the ICU at this time. At the step-down facilities, we have a total of 143 persons. These are spread between 4 facilities. They are the Brooklyn step-down facility, which is 19. The Tacarigua facility, we have 40 persons. At the Daybay Center, we have 53. And at the Balandra site, we have 31 persons. In our quarantine facilities, we have a total of 134 persons spread within 5 sites, and these are at the Paria Suites, we have 32 persons, Cascadia 34, Regent Star 16, Chancellor Hotel 24, and at the Home of Football we have 28. In terms of if we can go to my first map, thank you. So I had shown this map, I think 2 Saturdays previously, which actually shows the confirmed cases throughout the country as of the 6th of August, I believe. So if you look at the larger clusters, they are upwards of 6 or 7 cases. The smaller groupings in between, they were well aligned to the clusters in terms of when we did our contact tracing. They showed some indication, at least 60-70% of them were aligned directly to the larger clusters that we had found. It was not widespread throughout the country, and at that stage, Trinidad and Tobago fell into the WHO categorization of cluster spread. If you can go to my second map. Right, so this is up to recently, up to a few days old. We see the difference between the first map and the second map, right? One, if you look at the key as well, because there's an increased number of cases, the smaller dots now go from 1 to 2 cases. In the previous map, you would have seen the smaller dot representing 1 case only. So we have the key actually shows the small dots 1 to 2, and as we get larger, the largest dot that you will see is actually representative of 11 to 12 cases. So as you can see, the cases are now widespread throughout the country. The dots represent larger numbers of cases individually. There are dots in Tobago, and I'd like to go into a little more detail with Tobago. As you all know, there was a particular case that would have gone to a hotel in Tobago. Out of that 1 case in Tobago, we have identified 222 primary, secondary, and tertiary contacts. There are 204 primary contacts from 1 single case. So just to give you an idea of the potential spread of this disease from 1 individual who does not abide by the public health guidelines, And again, this morning we saw in force, as of 6 a.m., the new public health regulations that the Prime Minister would have alluded to on Saturday. So those are now in force. And of course, the legal framework is being drafted to deal with mandatory mask wearing. But we are asking the population not to wait for the legal framework to be in place. We all need to be on board with the public health guidelines, making sure we wear our masks when we're out in public spaces. We sanitize as frequently as possible. We distance ourselves from each other as much as humanly possible. If we have to go closer, of course, make sure you're wearing a mask. These guidelines, and most importantly, if you are ill, you need to stay at home. We have seen with a number of our cases that, just like the one I described in Tobago, that persons have not stayed home when they were ill, and it increases greatly the risk of transmission of this disease. We ask that the public health guidelines are not viewed in isolation. So if you're wearing a mask, we're not saying that you say you don't need to sanitize, you don't need to wash your hands, you don't need to social distance. They are all there to be used as armory to fight the virus together as one grouping. They are synergistic to each other, meaning that if you do mask wearing plus social distancing, your chance of getting this virus decreases significantly. So we are asking persons to abide by the guidelines. Let us get the virus under control. I think we had done very well in the first phase, and we can do it again, but we need the cooperation of everyone in Trinidad and Tobago to follow the guidelines. The new regulations are in force for 28 days. We will keep reviewing our status, and we hope that with the regulations, with mask wearing, we can get this virus once again under control in Trinidad and Tobago. Candice?
Thank you very much, Dr. Parasram. And now Dr. Nandram will give an overview of the log and lag epidemiological phases and insight into the local spread of COVID-19 over time in Trinidad and Tobago.
Thank you, Ms. Alcantara. Dr. Roshan Parasram, Chief Medical Officer, Ms. Alcantara, Director of Corporate Communications, members of the media, and of course, members of our viewing public. Today, I would really like to go into, in some more depth, building on, the contributions of Dr. Hines previously, the epidemiological situation in Trinidad and Tobago. So if I could have the first slide up, please. I'd like to draw a contrast between where we were previously and where we are today in terms of our distribution in age, the ages of persons that have been affected by COVID-19, and the sex distribution, the male-female ratio. So what this first graphic shows is the take-home message really is that the average age of persons affected by COVID has shifted down into the earlier age groups as compared to where we were early on in this outbreak. Very early in the outbreak, because of the majority of persons coming in from cruise ships and that sort of thing, the majority of cases that we found were in the older age groups. But now what we see is that the average age has dropped significantly into the younger age groups. The majority of cases in females occur between the ages of 35 to 39, and for males it's younger than that. It's the 25 to 29-year-olds that where most of the cases occur, and that's very concerning, and perhaps that's correlated to adherence to the public health guidelines, and that's something that we need to address. The next graphic that's up speaks to the lag and log phases that Dr. Hines touched on across the weekend. So this graph shows basically the curve, the cumulative number of COVID-19 cases in Trinidad and Tobago across time. So we had our first imported case in mid-March, and then there was that cruise ship cohort that came in about a week after that caused this rapid rise called a pseudo spike in the number of cases that Trinidad and Tobago saw. The last case in our phase 1 was near the end of April, and we stayed roughly at that level for quite some time. The first repatriated case came in at the end of May, and then the first locally detected case we found around mid-July. Now, between mid-July to the beginning of August, what we see there is that gradual increase in the number of cases that we're seeing coming in on a daily basis. And that's what epidemiologists refer to as the lag phase. It's where the number of cases are slowly increasing across time, and it's in the number of cases is effectively picking up speed. It's amassing that critical number of persons that start transmitting among themselves. After August, to where the graph tapers off, we see a very sharp increase in the number of cases that we're seeing coming in, and that is the log phase, and that's where the number of cases we see on a daily basis increases very, very quickly. And in the past, when we have seen cases of log increase and that rapid increase in the daily number of positive cases, public health measures have been put in, effective from 6 a.m. today. And those measures have worked in the past, and we look forward to persons' adherence to these public health measures in everyone's best interest. These measures have worked in the past, they have worked in other countries as well, and we're hopeful that these measures, as long as the public does adhere to the public health guidelines that are issued by the Ministry of Health, and persons take responsibility for their own actions, that we can control this outbreak, and we can hopefully very quickly get out of the log phase back into that stable state that we've been in for some period of time. Our current epidemiological situation is such that our doctors and our nurses are not our front line anymore. They are our last line of defense. This fight has now moved into everyone's homes. People need to take responsibility for their actions, and they need to wash their hands and social distance and wear their masks. The front line of the COVID-19 battle is now in the hands of the public of Trinidad and Tobago, and persons need to be responsible not only for themselves but for the persons around them. I'd like to just take a look at the last graphic, please. So this graphic shows positive COVID-19 samples by the date that the samples were collected at our health facilities. And this is what epidemiologists refer to roughly as an epidemiological curve. And it shows the increase by day of the cases that we received based on the date that the patient was sampled. I'd just like to draw reference to the average rise across time, and I'd like to mention that some of these single day spikes are correlated to the contact tracing process, where primary contacts were tested, meaning if there was a positive case, all the members of that family and persons that were primary contacts of that case were tested, and those results may have come in on that day. In addition to that, any symptomatic person that has been in contact with a confirmed case of COVID-19 is tested as well. So the larger spikes may not necessarily represent exactly what went on that day in the community, but is a cumulative effect of what occurred in the community, and as a result of contact tracing. I'd like to draw reference to the 8th and the 9th of August, and that slump there. That's simply a function of those days being Saturday and Sunday, and there tends to be a lower number of persons visiting health facilities during Saturdays and Sundays, resulting in a smaller number of samples coming in and a smaller number of positive results in turn. So I just wanted to highlight that. This effectively brings me to the end of the more in-depth look into our epidemiological situation, and I'd just like to reinforce the messages that have been put out in the media before, and echo the message by Dr. Parasram. Please, we encourage all members of the public to adhere to the public health guidelines that have been issued. Please be responsible, wear your mask, socially distance, and wash your hands. Thank you so much, Ms. Alcantara. Pass to you.
Thank you, Dr. Nandram. And we move now into the question and answer segment. Dr. Parasram and Dr. Nandram are here and ready to answer questions from media representatives. We invite you please to indicate your name and the media house that you represent before posing your question. In the interest of time, we ask kindly that you ask a maximum of 2 questions per media house, at least initially, and if we have additional time, we will try to facilitate 1 additional question from media representatives. And we begin with the representatives from 98.1.
And good morning to the panel again, and welcome, Ms. Alcantara.
Thank you.
Probably 16 before you as well. Just 2 questions quickly, one for Dr. Parasram and the other for Dr. Nandram. Dr. Parasram, there was someone who was reported to have traveled to Tobago from Trinidad while awaiting test results, only to show up later as a positive case on arrival. I'm not sure if there was any clarification as to how that would have been allowed to happen, because it begs the question of the possibility of other such cases which may have occurred, knowing that once you are awaiting results, there should have been some measure of you being quarantined. So that's for Dr. Parasram. And Dr. Nantram, we've had, sort of a different coloring of the canvas, as it were. From last week, we are now painting a new picture of the virus, having moved to community spread. I ask the question again, just how are we managing our threshold levels in light of an intent to maintain that 80% capacity that we've been talking about and not wanting to overstress the system? Thank you.
Okay, so Mr. Kamit, in terms of your first question, so basically we have seen that we move from a state of sporadic spread to cluster spread to community spread in a relatively short space of time. So our protocols in terms of who we swabbed, what advice was given to those individuals has to adapt accordingly. So persons would have been swabbed, let us say 2 or 3 weeks ago when we were in the cluster phase, and they would have been told by the physicians, if you are ill, we swab you as a community sample, for instance. So you have mild flu-like symptoms, you were swabbed, the advice was given to stay at home until you get a result that is negative. Of course, that advice was not heeded, and persons continue to move after being swabbed, after being told by the physicians that they should not have left their home during that period of time. So the advice was self-quarantine. In light of the case that you raised and other cases we have found, I had issued a call to all the CMOHs that every person that has been swabbed since be issued a quarantine form, and those persons would have been made to sign the form. So now, instead of giving someone the advice to stay at home, there's a quarantine order in place. Of course, as you know, if you breach the quarantine order, there are certain legal elements that sit in through the TTPS that can be enforced. So the process has changed as we move further along the continuum of cases. So now we are at the stage that once you are swabbed, you are given the quarantine order, which is a legal document to stay at home, rather than trying to just say verbally stay at home, so that there's something to enforce if people don't comply. Dr. Nandram?
Thank you. Relating to the evolution into community spread and how we intend to maintain capacity, we've increased capacity by adding a few new facilities. So that's one phase. But I found your question to be interesting as to what we are doing. We're in a state of community spread, and the responsibility for controlling community spread lies both in the hands of the Ministry of Health and in the hands of every citizen of Trinidad and Tobago. The only thing that the Ministry of Health can do is implement measures and make and issue guidelines and to curb the transmission of COVID-19. Several of those are already in effect and are at present public health measures that would reduce high-risk activities such as going to bars and the beaches and going to rivers, reducing movement related to in public interaction and other such measures. And of course, we've always been encouraging persons that are ill to please stay home, get tested, minimize your contact with other members at your workplace, your friends and family, to reduce the spread of this disease. We have seen cases where one singular positive person in the home has likely infected many other persons in that home. So even in households, we need to be careful. If anyone is ill at home, please isolate yourself at home as much as possible from your family, because the last thing you'd want to do is to transmit COVID-19 to those that you love. So I'd just like to reiterate that while the ministry is holding its end and doing everything that's feasible to increase capacity and to ensure that public health measures are enforced, the real battlefront lies in the homes of every citizen of Trinidad and Tobago. Our people must take responsibility for their own actions and must ensure that they do not spread COVID to anyone else, and in turn they protect themselves from getting COVID from anyone else. So those measures again are wear your mask, social distance, stay home if you're ill and get tested, and of course, you know, the keeping our hands clean is one of the main measures. I trust that answers your question.
Hey, thank you, Dr. Nandram. And we move now to Mr. Turner at I-95.
Good morning to everyone. Whitfield Turner, I-95.5. I just wanted to take up from Stephen's initial question. With respect to the CMO's office, are we working along with the Port Authority and CAL regarding the movement of persons who should be in quarantine from one island to the other? And has any consideration been given to the creation of some mechanism that will be triggered once someone who should be in quarantine shows up to travel, and they would then be denied boarding? And my second question, also to the CMO, now that we have revamped the reporting protocols in recent times, how does that affect Tobago? Is it that when someone is swabbed, the results are transmitted to your office, or are there additional steps and swabs of any kind still being sent to Trinidad for testing?
All right. So in terms of your question, what I'm hearing from it is, how do you prevent persons from one island going to the other island in terms of travel that may, one, be in quarantine? What we do is, in terms of the quarantine, whether you're in Tobago or you're in Trinidad, the quarantine order means that you stay at home. All right. So the Trinidad and Tobago Police Service will be given that full list of contacts, and once you leave your home, they will be the one to enforce if you breach. So the Port Authority and Caribbean Airlines are also form part of my interministerial task force, so they kept well abreast of issues that are going on. But as you heard the Prime Minister say, we're trying to keep travel to the essential between the islands, just to reduce that movement that has been occurring to a great extent over the last couple of weeks. So reducing movement generally, keeping it to essential travel between the islands, decreasing the capacity as we had done before to 50%, making sure people abide by the guidelines in terms of the quarantine, wearing your mask while on the flight, those kinds of things are what we're trying to drive home to the population. But most importantly, if you're on a quarantine order, you shouldn't be leaving your house. More so, shouldn't be getting on any flight or any vessel to go between the islands. In terms of your second question, if you could just repeat a little bit of it, because I'm trying to get to try to understand a little more exactly what you mean by the swabbing. If it is from Tobago side, from Tobago, basically what they have is a gene expert machine that has capacity to roughly do about 32 to 34 tests per day, 8-hour shift. So they use that right now. If they outstrip that capacity, basically what they will do is they will send any additional tests back to our Trinidad labs, and we will run those for them at the larger machines. So any further clarification beyond that? I don't know if you have any other parts of that question that I didn't answer.
Well, there was some concern that swabs were still being sent to Trinidad. It may have been via the community testing mechanism as well. So I just wanted to get it clarified as to whether swabs of any kind were still being sent to Trinidad for testing.
As far as I know, over the recent few days, none have been coming. But again, we will take what, if they don't have the capacity with the machine that they have, we will continue to accept samples from Tobago as usual.
Okay, Mr. Turner, that answers your question, I assume. And we move to Loop TT now. The floor is open for you.
Hi, good morning. Nika Personal here from Loop. Firstly, I have clarity on the phrasing in the example. This morning's release says 75 patients are en route / being admitted to hospital, while 46 new patients will be processed for admission. So what I'm trying to gather is the 29 people, where have they been all this time? I think it's important to note, since questions have been raised about people being treated at home or people not immediately being admitted. Those have been in the public domain for a while. And second question, just to stay on top of things, how many private labs do we have that are certified to test for COVID-19? And can you tell us which lab it is? Because we've seen a few of them advertising the service. And then even over the weekend, we saw one of these labs with a very long line. So just to clear things up in the public domain.
Okay, so I think you're asking about en route means basically you have already in the process of getting into an ambulance and coming to one of the health facilities. Being processed means that the positive result has already been received. You are in the process of being informed of that result, and the next step will be to get an ambulance assigned to you to be bringing you into the facilities. In terms of the private labs, I answered the question a couple of days ago that we have one private lab that is certified for a particular type of PCR test. Not certified, sorry, has been approved to use. There's another lab that has also been approved to use, but they have difficulty getting the test kits for that particular test. So when they get that kit, we will have to, then they will be approved to go forward. So there's one lab that actively is running tests in the private sector, and the other one is waiting to be approved. By way of the names, again, I don't want to divulge the names. Persons are free to advertise and say approved by the Ministry of Health, which they have been doing. So basically, that I hope that answers your question.
Thank you, CMO. And we move now to Tobago Channel 5.
Hi, good morning. Candice Jackson from Tobago Channel 5. My question, I just want to bounce off a little bit from Whitfield's question a little bit earlier. And in regards to persons traveling between the islands. Now, I know you said that you are in meetings and so on, you're apprising the Port Authority and CAL frequently, but is there any thought to putting up at least a no-fly list? So, for instance, for a person who has been tested and that sort of thing, and you're still waiting results, so that their names are put in the system, so that even if they, somehow got out of their homes and decided to travel, they would not be allowed onto the plane or the ferry, because we've been hearing some interesting stories of persons running away from Trinidad who may have gotten tested positive and coming to Tobago, which would have led to some of the spread.
No, well done.
Thank you very much, CMO.
Yeah, so we are looking at a number of measures, I think, to implement to ensure that persons are on a watch list for the Caribbean Airlines and the Port Authority. We have to be mindful with patient confidentiality as well, that we don't release too much information out in the public domain. And that's something that we have to continuously be wary of, because if you say someone is a primary contact, it is a very small society. People learn of person's name, where they live, and all of that information is out there in the public. So far what we have done is, as I said, we share that information. CMOH is all collated and they share it with the TTPS for enforcement. We will consider flagging it confidentially to possibly CAL as well as the Port Authority. I will have that discussion with my interministerial team, looking at confidentiality, how the data can be secured, and if there's a viable solution, we will certainly do so in the coming days.
Okay, thank you, CMO. We will now field questions from Trinidad Express. I think we have Ms. Boudram representing Express today.
Good morning.
Good morning.
Good morning.
We can hear you.
Thank you. Morning, doctors, everyone. We were really hoping to see the health minister. Sorry to not see him, but I would like to ask either of the doctors or CMO CMO, was there an issue that led to a public walkout, of personnel at the public health lab at the weekend on Saturday, we believe? If you could shed any light on that. Also, can you tell us how many medical personnel, let's say doctors especially, are currently in quarantine? And without divulging too much, tell us if any of our doctors were actually confirmed for COVID-19, and overall, how many of them may be out of commission? How much of our personnel might be out of commission as a result of quarantine testing, etc.? Thank you.
Okay, so in terms of the lab, as Minister would have alluded to, there's a report that is pending out of the lab that we are looking at actively. We had continuously put additional staff into the lab because of the sheer numbers of tests that are coming in. Our national lab, as you noted, Minister would have indicated as well that North Central's lab is up and running as of Saturday, sorry. So North Central now has a lab that is up and running. The Eastern Regional Health Authority also commissioned their Gene Expert, which is a smaller capacity machine, a couple of days ago. So we now have a machine at Eastern. So there's one at North Central, at the University of the West Indies, in Tobago. And then, of course, the Caribbean Public Health Agency continues to work. Once we get the information out of the lab in terms of full report, we'll come back to the media houses and the population to let you all know. I think the major issue that we have been having is trying to clear the backlog of cases, and we are putting measures in place daily to do just that. And hopefully, in short order, we will be able to clear the backlog and move forward in terms of the number of tests, so that, as you have noted, there would have been, in some of our releases, we would have put tests positive over a certain range of periods, a number of days. So hopefully in the near future, we can decrease that period and get very relevant in terms of 24 to 48 hours in reporting. In terms of your question related to the medical persons, there have been healthcare workers both in the first phase and in the second phase testing positive for COVID-19. I don't have the exact figures of healthcare workers with me right now. We can always get that to you at a later time, but they have been positive healthcare workers in both phases.
Okay, thank you, CMO. And now we'll take questions from Newsday, please.
Hi, good morning.
Good morning.
Hi, good morning, everyone.
Morning.
I wanted to find out from the CMO if we could get an update, a further update on Tobago in terms of how many people may be critical or in step-down facilities there, and have any of the recent deaths come from there? Another question is, there's a video circulating of a young man in Tobago who said he and two relatives tested positive, but health officials took a few days to attend to them. Are you able to comment on this?
Okay, so in terms of the positives, I believe we have 17 from Tobago at this point. There was one individual who was not critically ill, but very ill, that was transferred to Trinidad a couple of days ago, and now is at Couva Health Facility. So there was one person that was very ill. The rest of them remain fairly stable in the facilities out of that cohort. In terms of your second question, I don't want to comment specifically at any individual, but if you can send that information to us offline, we can look a little deeper into it. I can get on to Tobago, and we could possibly get a little more into that answer. All right?
Okay, thank you, CMO. And we move to TV6.
Good morning, everyone. Urvashi from TV6. Ms. Alcantara, I'd just like to request that maybe these conferences go a little beyond the hour, because we do have a lot of questions coming in from the public. And just a quick comment on the log and lag. Log and lag would give the impression that it's a naturally occurring wave of the virus. But in fact, what it appears to be is a phase 1, which was controlled and then breached by open borders. And then we had another phase 2. Log and lag, when I look it up on Google, it speaks about the growth of microbes. So to my question now, Dr. Nandram, you put an interesting graph up just now, which showed the actual, well, what should have been the actual positives recorded on each case. And that really contradicts the information that was relayed to the public at certain points in time. For instance, 6th, 7th, and 8th, there appear to be a lot of positive cases detected And on the 9th, the day before the election, there were 4 cases. On the day of the election, there were 2. And then after the public gets results from August 5th, and if the public did have those results, maybe they would have been able to make a proper decision on their behavior. Would you agree that the batching of results was done at a critical time to create a false sense of security? That's my first question. My second question is, Dr. Parasram, did you err in not giving this advice to roll back measures 2 weeks ago? Because the cases that we are seeing now are, in fact, representative of infections that would have occurred within the past 2 weeks. Thank you.
Okay, so let me take the first question. So in terms of my recommendations, as I have said many times on the program, the Ministry of Health continuously makes recommendations as to what steps to take. If you had noted, just prior to the election, there was the change in the gatherings from 25 to 10, which was a significant public health change. However, I don't think persons abided by the 10 or even 25 or even 50 at that time. So recommendations will continuously be made to our line minister as we go forward. And as you noted, there was significant change over the last few days. But the Ministry of Health's role is to continuously assess the situation and make the recommendations as we see fit to the ministers. Dr. Nandram will take the second part of the question.
Sure, thanks. Would it be possible to pull up the lag and log phase? So the first thing I'd like to do is thank Dr. Avery Hines, who is a medical epidemiologist with a master's degree out of Cambridge in epidemiology, that created this graph for today's media conference. And Rashi, not to discount your Google search relating to microbes, but the evolution of the number of cases in any outbreak follows this natural pattern: an initial lag phase and then a log phase. If you look at any outbreak pattern, the normal pattern is a bell curve. An initial lag phase rising into a log phase where it peaks and then gradually comes down the other side of that curve in a bell-shaped fashion. So there is a initial slow increase, a rapid, called the lag phase, a rapid increase in number of cases called the log phase. It comes to a peak as the population, the number of cases in the population climbs, and then gradually the number of cases that we see tapers off back down. And this is the same pattern that we've seen in Trinidad and Tobago and every other country in the world with COVID. This is the same pattern that we've seen with Zika, the same pattern that we've seen with chickpea and every single other infectious disease. I'd like to reinforce that if you look at the epidemiological curve of many other countries in the world, this is the same pattern that you'll see. I'd like to address the following, I believe it's graphic. Can we switch back to the third graphic, please? So the number of, this is what epidemiologists refer to roughly as an epi-curve, an epidemiological curve, and it's much more accurate representation of what's going on in a population than singular counts on any given day. As was put out into the public domain, that this is a situation where, because of the volume of samples that we're receiving, that systems had to be put in place to manage them, and it's not a matter of batching at all. I can attest to the dedication of the Trinidad and Tobago Public Health Lab and their director in getting these results out as soon as possible, but in a similar manner that the public health system needed a parallel healthcare system to cater for this large influx of COVID patients. The laboratory systems also needed that additional support, which is why additional testing sites have been established and will continue to be established moving forward. The fact of the matter is the lab was receiving sometimes in excess of 1,000 samples a day, and there are only a handful of persons there, and they're not machines. Trinidad and Tobago Public Health Lab has a staff that is dedicated to the service of public health. They come in 7 days a week. They're there from 5 in the morning till 11 p.m. sometimes. There was staff in the lab yesterday on a Sunday, and I was there with them until after 9 o'clock at night on a Sunday. That's the dedication that the persons based at TPHL have to driving the cause of public health in Trinidad and Tobago. And I can assure you that it's not for it's not accurate to say that the way this graph looks is a function of something that happened in the lab. Like I took the time to point out that on the 8th and the 9th of August, immediately prior to elections on the 10th, those were Saturdays and Sundays. And maybe it's because persons were engaged in other activities. Maybe it's because it's a weekend and they want to spend time with their family. But on Saturdays and Sundays, as is the normal pattern, the number of samples that we receive at the lab is smaller because persons simply don't come out to health facilities in the numbers that we see during the week. It's not, there's nothing sinister here. It's just a normal function of the patterns that we've seen. I hope that addresses your question.
Thank you very much, Dr. Nandram. And now we move to Wyatt 868, please.
Hi, good morning. I wanted to ask how many employees are there at the epidemiology division? And with, say, 20 positives in one day, how many contacts would you expect to check there, and how many employees would you need to carry that out? And secondly, understanding the respect of patient confidentiality, but for the sake of humanizing cases as much as possible, which we hope would drive out complacency, is the Ministry of Health willing to give any more data like age or occupation in positive tests, or maybe name the pre-existing condition in terms of deaths, be it asthma, high blood pressure, and so on? Thank you.
Yeah, so your question relates to contact tracing and the number of people at the epidemiology unit. So it's two different things. So there's an epidemiology unit based at the Ministry of Health that is responsible for collating the data that comes from the peripheral system, both at the hospital as well as the CMOH office, which deals with the primary care setting. So the epidemiology unit is responsible for producing graphs like what Dr. Nandram would have said after they have gotten the information from throughout the country. So they are responsible for collating, analyzing, and really recommending, based on evidence, measures to be put in place and saying to us what are the trends that we are seeing. The community tracing and the tracking of cases really comes out of the offices of the CMOH, rather, not the epidemiology unit. So the CMOHs, as we noted before, there are 8 in Trinidad, there's 1 in Tobago. Those persons are tasked with the function of actually contact tracing every single person. They do swabbing of the primary, secondary, tertiary contacts. They would advise, their offices will advise on what steps to take if there's a business place implicated, for instance. How do you sanitize? So that comes out of the local level, which is the county level. So there's a CMOH for every county in Trinidad, and they will be the ones with their staff, physicians, nurses, surveillance staff, administrative staff, and really and truly the CMOHs have been, as well as the TPHL, working, doing yeoman service for the people of Trinidad and Tobago. I'm having a meeting with them at 2 p.m., as the minister would have advised, to actually look into additional staffing. We already have 25 physicians and 50 nurses to be assigned, hopefully during the course of this week, to each of those, just to be spread across all of the agencies so that they can get additional staffing, because the numbers are extremely large in terms of the number of persons you have to contact trace. And if you look at that one case that I alluded to, with over 200 contacts from one case, and we're getting 10 or 20 cases per day, you can see the numbers exponentially will increase. So we are beefing up the staff at the CMOH offices as well. After I meet with them, I'll get their additional needs beyond nurses and doctors, which I had solicited a couple of weeks ago from them. So they will tell me if they need any other staffing, any other equipment to perform the contact tracing function in a better way. Okay, I hope that answers your question.
Thank you, CMO. And now AZP News.
Hi, good morning. Priya Bihari, azpnews.com. I want to follow up, a little bit on this lag. When someone is tested, there is a lag from the time they get the results. I know you spoke about this already, but some people are concerned that sometimes they're taking up to 2 weeks to get their results, and in interim, they are infecting, in some cases, their primary contacts at home. I don't know if the ministry is doing anything to speed up that, or is there something else that can be done? That's my first question. And my second question has to do with the regulations in terms of pools, of public pools. There are a number of clubs, you know, who do swimming, and they are private in the sense that they're only for members, and they wanted to know if they can continue to do these swimming in the club, because they also practice the social distancing, etc., and at these facilities, which is not a public, you know, where members of the public can come, but only for members of the club. Thank you.
Okay, so let me answer the question related to the regulation first. So the regulation, as it relates now, which started 6 o'clock this morning, a person who is in breach, and this is regulation 3.1a, be found at or in a beach, river, stream, pond, spring, or similar body of water, or any public pool. So public pool is out of the question based on the regulation. As you related to private pools, people, I think we need to understand that we're in the middle of a pandemic. We have now reached the phase of community spread in Trinidad and Tobago. We are trying to tell the population that you should not congregate for any reason. Stay at home as long as you can. If you have to go out to get essential services, do so. But anyone that ventures beyond that puts themselves and their families at significant risk of contracting COVID-19. In March, I had said that we need to behave as if the person next to you, anyone in the country, has COVID-19. There's no magic test that you can take. There's no appearance of an individual that will show you that they have COVID-19 by looking at their face. There's no red dot that will show up that shows that they are positive. So we need to behave again as if everyone around us has COVID-19. It is an invisible virus that we're finding invisible to our eyes. We are fighting against. There's no way to tell who has it, who is going to transmit it to you. Swimming at this point, in my view, humble view, is non-essential. So we are asking people to use your discretion, look at the activities that you are accustomed to, and let us all stick together, decrease the risk for each other, and by extension, get this curve under control again.
Thank you, CMO. And I think
Dr.
we...
Nandram.
Oh, sorry, Dr. Nandram, please.
So in addressing the second part of that question with regard to the delay in reporting, positive cases are notified immediately to the CMO and myself, and that triggers the cascade of action immediately. The county medical officers are notified within minutes of the lab finding a positive, and they enact the contact tracing process where the person is notified. The clinical team is alerted in the same mechanism. So that loop of notifications between the lab and the clinical team and the county medical officer of health ensure that the person is notified and moved into a quarantine facility as quickly as possible. That mechanism is not delayed by any measure and is not contingent on a person receiving their result later on. That's not something that we allow to occur. I hope that answers your question.
Thank you, Dr. Nandram. And Dr. Parasram indicated that we may have missed inadvertently the second question from Wired 868. Mr. Leiber, did we answer both your questions?
No, I think he was basically asking if we could give a little more information in terms of the deaths. WHO has guidelines in place that we have abided from day one in terms of and of course, based on patient confidentiality, our code of ethics as it relates to the medical practice dictates that we can't let out certain pieces of information as they will be viewed as identifiers to the general population. So we view critically our information that we send out to the population, especially as it relates to deaths. But when we say comorbid conditions, generally speaking, in this setting, we're talking about people with diabetes and hypertension, those chronic heart disease, those kinds of illnesses. When we put that in those are the general categories that we are trying to capture.
Okay, thank you, CMO. We move now to TTT. Hi, and we're just awaiting the questions from TTT, Mr. Wason.
Morning, TTT News, Ian Wason. A lot of persons have had concerns about the hotline system. Some are saying it's either not working or not working efficiently. And one person was made to call at least 4 times without any success. And can you give us an update about the status of the hotline system if possible, please?
Sorry, Mr. Wason, could you please repeat your question? We didn't hear you clearly.
All right. Some persons have had concerns about the hotline system. They are saying it's either not working or not working efficiently. And one person called 4 times without any success. Can you give us, please, status of the hotline system?
So as we noted before, there was an issue and we sent out a press release with so 2 lines were feeding into one call center. So one of the lines actually was down for quite some time, and that is being in the process of being sorted out by our ISIT division. So once that has been rectified, we hope that it will assist the problem. But we did send out a press release a couple of weeks ago indicating which of the lines are active and which line that you should not be using. So we're hoping, of course, there's an increased number of calls, and we're trying to put measures in place at the back end of it, meaning getting more persons on stream to be able to answer those calls. But hopefully we can rectify the information system error in the shortest possible time.
Okay, and now we'll accept questions from 91.9 FM.
Hi, good morning. Vern Extavor, 91.9 FM. Just quickly on the testing, it may more be a comment. I've gotten a couple of phone calls that persons have been going to health centers for testing and not been able to access it. One person said that they were at a bar per se, and they identified that they were at a bar and they were denied the ability to get a test at the particular testing facility. I just wanted to give some opportunity to the CMO to give us a little bit guidance for persons who want to get tested, who may be suspected or who suspect they may have been in contact with a COVID-19 patient, give some guidance to them in terms of how that testing is done and whether they would be able to access testing. If that is possible, that will be helpful. Also, the regulation states that no private lab has been granted approval by CARFA with respect to conducting COVID-19 tests. I just want to know if you could explain that regulation 8.1 again for us in details in terms of private laboratories being able to do tests and the confidence that the citizenry could have in actually going to a private lab to get a test done. Is that something that, I know you can't endorse, as you said on the last press conference, you can't endorse a particular lab, but if you could give some further guidance or whether people could go to private labs, especially considering that they're having challenges going to the public facilities. Thank you.
Okay, so as far as, we'll be happy to, if you could send that information to us offline as to which health center was visited and what was the particular issues that the person was turned away. No one is supposed to be turned away that presents with symptoms to one of our facilities. Even the mildest of symptoms we are now sampling. If you have sore throat, you have runny nose, you have even loss of taste or smell, we will sample that particular individual right away. So if you have that information, we can try to look into it a little further to ascertain what was the cause of the issue, why the person was turned away. But no one is supposed to be turned away from a particular facility, especially when showing up with symptoms. If you, however, show up maybe for reasons of wanting testing to leave the country, for instance, a lot of people have been given exemptions to leave the country. It is not something that we really put as high priority from the public sector. We are looking to test persons that are symptomatic or persons that are related to a case that has been tested positive before. In terms of your second question, Dr. Nandram,
can you just repeat that second bit?
So just repeat the second question first, Vin.
Right. The second question relates to the regulations. The regulations do state that no private facility has been approved by CARFA just yet. So we wanted to get some kind of an idea of how confident can citizens be in accessing private facilities to get COVID-19 tests done? I know you said
so
there's one lab that you had, we didn't want to endorse, but we could go with. But people want to get a little bit more confidence in using private labs to get COVID-19 tested. Is there anything that you could offer?
yeah, so as I said before, there were two. When I discussed the labs, there were two labs that have been. We use the word approved loosely because there's no legislation for laboratory certification in Trinidad as yet. So legally, the Ministry of Health can endorse or approve a lab. So the terminology has to be around those lines rather than certify. However, they would have gone through a rigorous process of one, inspection of the lab. We would have done a panel of tests from the Caribbean Public Health Agency. They would have gotten that as almost like a test kit. So they would have done that and passed. So those two labs that we alluded to, we can be fairly confident of the results that are coming out of those labs, that they would be positive when they are really positive and negative when they are negative. Bearing in mind the ministry still receives, for instance, if they have positive results, we still send that for a second test to the Caribbean Public Health Agency to verify. And so far we have been in good stead from the private labs that the tests that they have sent forward have been coming back positive as well. So I think the quality assurance part of it is there. So the public can be reassured that the ones that are advertising as have been approved are well within our quality assurance, quality control standards.
Thank you, Dr. Parasram. And now Guardian Media Limited.
Hi, good morning. Charlene Abusad, Guardian Media Limited. Both of my questions are for the CMO. First of all, can you tell us how many ventilators we have available for the treatment of COVID positive cases? And can the CMO address rumors that dozens of positive cases came from a yacht party that happened somewhere down the islands over the last couple of days?
Okay, so I can get the number of ventilators to you that is in the system. So I think we will get that number to you offline if it's possible. The actual number, I know we're supposed to get an additional 11 ventilators sometime this week delivered into our system, but we have an adequate supply at this time. But we will get the numbers to you offline. I believe that question was already answered over the weekend at the Prime Ministerial Press Conference. And Dr. Nandram alluded to it. Any test that is positive, and we just want to remind the private labs that are doing these tests, any test that is positive needs to be reported to the office of the CMO under the regulation, and of course the fines are commensurate with not reporting. And the labs so far have been reporting to me in a very timely manner all the positive results that they have. There's one particular lab that actually sends me via WhatsApp as soon as they get a positive test. So there should not be persons in the population that are testing positive for whatever reason, and the Ministry of Health is not aware of it. So basically the regulations are made to cover that aspect of it, that persons were going privately and being tested and not giving us the result. The regulation is meant to capture and safeguard against that happening, so that everyone that is positive, whether it's done by private test or public test, the ministry is aware and we are able to take corrective measures in terms of getting those persons into an adequate facility, as well as doing the contact tracing that will follow. So we are aware, as far as we are aware, there's no such incident that would have occurred.
Thank you, CMO, and we're coming close to the end of time. We're able to take, at this point, one brief question from 98.1, please.
Yes, thank you again, Ms. Alcantara. And Dr. Parasram, I believe you're wearing two hats this morning, one from a medical viewpoint and the other from a policy viewpoint. My question, some of our popular beach spots over the weekend were washed with alarmingly huge crowds of persons, I suppose, who felt they should take the advantage of the conditions prior to the rolling back of measures that we're seeing today, but yet were in stark breach of regulations that existed prior to today's further adjustment to the public health ordinance. I'm wondering what happens now. Could beachgoers now be made to face penalties? For example, surely many persons would have not, would not have been difficult to find because we do have photos, there are videos, and there's so much that's circulating around. Is it that these persons could be made to face some sort of penalty? Thank you.
The regulation came into force, Mr. Cummings? Sorry?
Yes, Dr. Parsaram.
So before the regulation came into force, there was the regulation that was in force as of Sunday was related to the number of persons that could congregate in terms of gatherings as 10. So again, that is a matter for the Trinidad and Tobago Police Service, and I believe an enforcement matter prior to today. In terms of the public health regulation, again, it is a matter for the police force. So now that the regulations are in force as of 6 o'clock this morning, I suppose anyone that is found, as I read the regulation 3.1a, that alluded to persons found at a beach or a river or a stream or a pond or a public pool, can be fined based on the public health regulation. So that will come into effect as of 6 o'clock this morning. What we had in place yesterday was a regulation that spoke to congregation in excess of 10. Okay?
Thank you, CMO. We have come to the end of today's media conference. Thank you, everyone, for your participation this morning. Protect yourself, your loved ones, and everyone from COVID-19 by following the new normal guidelines. Have a good day.